Hello. So I wanted to talk to you about ways in which you can try and identify whether you have or your patients have some issues with pain. And by issues with pain, I mean that, so why is that person's pain perceived as high as they're reporting, or why has it gone on for so long? One of the things that I like to look for in clinic is any signs or symptoms of what we call central nervous system sensitivity. So signs of this and clues of this could be sensitivity to light, sensitivity to sound, to touch, scalp sensitivity is another one, even sensitivity to smell in some patients. They will report that with certain sounds and smells that they feel quite irritable, so they get that irritability and nervousness feeling when they're experiencing that, and that could be as simple as a bus driving past them on the street, or a high-pitched alarm going off, or anything like that, and they just feel like it's overload for their nervous system, which it is essentially. Other things that you can clues that you can look for is differences in sort of temperature throughout the arms or the legs, so feelings of incredibly hot or incredibly cold and fluctuating between the two. That can also be a result of that, and also a link of what we call the autonomic nervous system as well. Another thing that I delve into, which a lot of other therapists I think just tend to brush over because you're taught to brush over it, which is something that I'll come on to in future videos, I'm sure, but psychosocial history. So often this would have been labelled as what we call yellow flags, which is, you're taught in university that anybody with yellow flags will not respond to physio, which is absolutely ridiculous. So things that I would delve into a little bit deeper in terms of the subjective history would be any previous significant traumas, be it mental or be it physical, especially with the chronic pain patients. So is there some sort of specific life event around the time that this cycle of chronic pain started to develop? Also, any previous experiences from loved ones. People will always associate themselves with an experience that they have witnessed in somebody close to them. So you will hear a lot of, oh, my mum or my dad suffered with arthritis in the knees, and I think it's just now it's happening to me. Or, yes, my dad suffered with sciatica for several years. So they tend to link themselves to that, to somebody else. And obviously how that person was managed in terms of their physiotherapy treatment or pain management treatment will have a huge bearing on how the person in front of you is going to cope. So other things that I also look into is all the usual things. So any increased stress, be it work, be it home, signs and symptoms of anxiety, any health anxieties, any social anxieties, financial issues, just any sort of external pressures or internal pressures that will definitely need addressing and actually talking about within your sessions. So I think sometimes we can feel that because we are physiotherapists and we are it's supposed to concentrate on the physical, that if somebody does open up to us and tell us, well, actually there was a significant event, I suffered from post-traumatic stress for several years, we tend to just go, oh, okay, all right, anyway, back to your back pain. When it's just such a huge link, we should stop doing that. We need to start having the conversations that you are quite capable of having as you are with another human being. And even just bringing them to the surface lets the patient know that you are actually willing to accept and talk about some of the bigger issues around their life as well. So obviously you do still look at the physical, but what I'm saying is that you will never get somebody out of a chronic pain cycle or a severe acute pain cycle, which seems to be really catastrophizing the situation, unless you delve a little bit deeper to find out whether, one, they have any central nervous system sensitivity, or two, they have any psychosocial significant history behind them.